Now, World Oral Health Day 2024. Be proud of your mouth. Now, on the 20th of March every year, we ask the world to unite to help reduce the burden of oral diseases, which affect individuals, health systems, and economies everywhere. Now, what is the purpose of Oral Health Day? World Oral Health Day aims to empower people with knowledge, tools, and confidence to secure good oral health. Now, why is World Oral Health Day important? Oral diseases are a major health concern for many countries and negatively impact people throughout their lives. Oral diseases lead to pain and discomfort, social isolation, and loss of self-confidence, and they are often linked to other serious health issues. And yet, there is no reason to suffer. Most oral health conditions are largely preventable, and it can be treated in the early stages. Now, this afternoon's guest is Dr. Masoodah Essop. Now, the theme is, a happy mouth is a happy life. Now, Dr. Essop qualified in 2017 from WITS as a dentist and is currently working in a private practice at Mill Park Hospital and recently completed her postgraduate studies in public health. Dentistry is not just a profession to her, but also a passion, as we'll soon find out. She believes patients are not just a set of teeth working through the door. She is motivated by a special interest in aesthetics and rehabilitation dentistry and advocates for delivering patient-driven care that is holistic. So this afternoon, our guest in studio, or on the line at least, is Dr. Essop from Johannesburg. How are you doing this afternoon?
I'm very well, thanks. Thank you for having me.
It's good to hear from you. Now, I'm just going to get straight into it this afternoon for World Oral Health Day. And as we get into it, I just need to remind shoppers and listeners that are listening right now, at the moment, at Clicks, if you are looking to improve your oral health, you can buy any 3 oral health products from the same offer and get the cheapest one free. Whether it's to brush, floss, or rinse, you can take advantage of the Colgate offer right now where you buy any 3 items and get the cheapest one free. So make sure to get that in store for today. Now, Dr. Essop, I want to ask you, why can't I just pull the tooth if it hurts? Teeth are just as important as any other part of the body and it adds to the balance of your body. But if you just pull out the tooth, the balance is disrupted and unknowingly the side with the most teeth are favored. Can you explain a bit more about that?
Okay, so like you rightfully said, that basically what happens is you now lose a tooth, so you actually unknowingly want to use the other side of your mouth just because your body wants to try and be as efficient as possible, and it tries to compensate. And then the minute it tries to compensate, you will see that you'll use the one side more, and then that will actually cause that side to wear out a little bit faster. And once that side wears out faster, you end up having like the seesaw repercussion of needing to take teeth out back and forth, which is, of course, isn't healthy. And, you know, it affects the balance overall, in your face and overall. So, yeah. So we just don't want to pull teeth out where we can. If you can save, it's always better to save.
I see. Kind of makes a lot more sense now that you've balanced out that, with the answer. Now, I'd like to ask you, why do dentists say that we all need to go for a 6-month checkup?
Okay. So, with regards to 6 months checkup, it's because your tooth can't tell you something's wrong. Like, for example, just when you get a cut on your hand, you can feel that immediately. Yeah. But with the tooth, it starts to decay. And you don't actually have nerve or feeling right at the top of your tooth. That pain feeling that you have only happens when the decay goes further into the tooth. And by then you're coming to the dentist because now you're in pain and possibly infected. And then the dentist is throwing, scary words around like root canal treatment and extraction or tooth pulling. And now you're very scared, and it doesn't give us a very good rep. But if we had gone for the 6-month checkup, we would have taken X-rays. We would have seen that, there's like a slight hole, what appears to be a hole, or a slight beginning of a cavity or decay in a certain area. So we will fill that before it gets to the stage where you're feeling pain and you're coming in with pain or infection or an emergency. So,
talk about getting down to the root cause of the problem, eh?
Right.
All right. Now, I'd like to ask you, do we have to go to the dentist immediately if a tooth hurts?
Yeah, so that's basically a great follow-up question from the first one. When your tooth hurts is when the problem is quite severe. So unlike skin, that if you get a cut, it will repair itself. If you leave it alone, or you just disinfect it a little and put a plaster over it. Mm-hmm. With teeth, what's going to happen is the problem is just going to get worse and worse. And then when we're in for trouble, then we have to do root canals or extensive procedures, which the patient doesn't appreciate and doesn't, fully understand, and, thinks that it's not worth it, but that's the only way to save the tooth. So if the tooth hurts, the faster you go in, the more chance that we can actually save the tooth and not have complications, and actually treat you that the patient will be happy and satisfied.
So I'm assuming it's not advisable to actually use my patch and solution set that I've got at home to fix my own tooth. I have to go to a dentist, I'm assuming.
Please don't do that, yes.
Okay, now on the topic, teeth and digestion. Obviously, you don't want to digest any glue, but teeth and digestion, what's the connection between the two?
Okay, so that actually ties well with the fact that we don't just want to pull teeth, because I always explain to all of my patients that come through, I say there's a reason why God gave us 10 fingers and 2 eyes. It's because we actually need 10 fingers and we only need 2 eyes. Mm-hmm. If we needed 10 eyes, He would have given us 10 eyes, for example. So with that being said, there's a reason why God has given us, or we are equipped with 32 teeth. It's because we actually need all 32 teeth for function and mastication or chewing. So if I'm removing all my back teeth, what ends up happening is I don't actually chew my food well enough. So the food that enters into our digestive tract is a bit more whole than what we should be having, because I'm sure you've heard that we have to chew our food 32 times,
of course.
Which actually pulverizes. If you've tried it, it turns the food into liquid almost. But with that being said, you need to understand that that's clearly what the body wants to be able to digest. Yeah. Imagine digesting liquids compared to digesting solids. How much more acid needs to be produced. So if we don't have enough teeth in our mouth, we're busy putting food into our tummies that isn't as well chewed on as it should have been. And then it's much larger, you require more acid, and then it takes a bit longer to digest, or it's a bit harder to digest. And then you come up with your body producing more acid, and that actually relates to a host of other gastric issues. So, yeah. That's where the correlation lies, is that the right amount of teeth we've been given, we should actually aim to have that amount of teeth in our body at all times to be able to help us, digest our food well enough.
You mentioning digestion and acids and everything. I'm getting a bit sensitive to that. And just in case you're listening to this interview and you'll have teeth that are as sensitive as I am to the discussion at the moment, you make sure to take advantage of the 3-for-2 oral healthcare offer on right now. Buy any 3 Sensodyne oral care products and get the cheapest one free. So if you have sensitive teeth, make sure to take advantage of South Africa's #1 sensitivity toothpaste. It's Sensodyne, available in store at Clicks in a 3-for-2 offer. Now, Dr. Essop, I want to move on to the next question, and I've taken a look at this now, and it's pretty pertinent. Why do I have to save my child's teeth if they're going to get more teeth?
Okay, so that's a great question, and that is actually a question we get asked quite often. That can't you just pull my child's tooth out? It's sore. So yes, we can, but so we say baby teeth or primary dentition, they have 2 purposes. One, obviously, is the aesthetic, or what it does to a little child's face, how your child appears, either naughty or not so naughty or nice. Mm-hmm. And then the second thing is that it helps with chewing ability, place holding for where the adult teeth are going to be positioned. So now your child needs to pull out all his front teeth, but your permanent teeth or your adult teeth come out one at a time. This first tooth has, free reign of where it's going to go in the front segment of your mouth.
Yeah.
Whereas if the first tooth had fallen out naturally, your body is like, that's the place for my permanent teeth to go. So it will slowly make its way to the top in that position. So yeah, baby teeth are important in the essence that they're placeholders. They aid with also like nutritional, development as well, because if your child's teeth is sore, you pull out all their baby molars, what are they going to chew their chicken with, So, yes, it is very important. Just because you are getting a new set, you don't just want to, discard that set and say, oh, well, I'm going to get another set. I can do what I want with the first set of teeth that I have.
Yeah, that sounds... No, I agree with you. We do need to take care of that because obviously, as you mentioned, with the digestion, with the chewing, kids love chewing for hard things, especially hard candy and apples and carrots.
Yes, definitely.
Right. Now, we are having a chat with Dr. Masoodah Essop this afternoon from Mill Park Hospital in Johannesburg, and we are discussing this with her. It is World Oral Health Day on the 20th of March, and she's busy sharing some pretty amazing information with us about oral health. Now, we've had a very good couple of minutes of just chatting about why it's important to have a 6-month checkup, and when we go to a dentist, especially if a tooth starts hurting, and also talking about the digestion and the correlation between digestion and teeth. Any closing thoughts from you, Dr. Essop?
In closing, my simplest advice to all my patients is that the more you come or the more regular you are with checkups, the less likely you're going to have issues in your mouth and the less scary we as dentists are going to see. It's going to be quick in, out, do a nice cleaning for you. You almost feel like your teeth feel happy afterwards. And it's one less area in your body that's concerning. Mm-hmm. So my closing thought is just, if you are able to and you are in a financial position to, and most medical aids do cover, 6 monthly checkups, it is well worth your while to invest in that little bit of prophylactic or preventative treatment, to stop any major problems happening in the future. Yeah.
Okay. Prevention is better than cure. That's what I'm getting from this interview and this chat this afternoon.
Yes, 100%.
All right. Dr. Masoodah Essop from Mill Park Hospital, thank you very much for your time for this afternoon and for sharing your professional advice.
Thank you so much for having me.
Thank you. Now, this oral health interview is proudly brought to you by SADA. SADA's vision is to be recognized as a trusted leader and voice of oral healthcare in South Africa. Their mission is to promote the interest and serve the needs of our members and above all, encourage optimal oral healthcare for all South Africans. Now, you can learn more about the South African Dental Association by visiting the website www.sada.co.za. Also be sure to check out more about the Young Dentist Council. All the speakers during this week's oral health awareness interviews are part of the Young Dentist Council Exco. Learn more about the Young Dentist Council by visiting our website sada.co.za /Young Dentist Council YDC.